As- Assalamu alaikum, everyone. I am Dr. Samia Arifin, Education Secretary of the Australia Bangladesh Health Forum, in short, ABHF. Thank you all for joining us today. We truly appreciate your time and interest. Today's webinar focuses on dentistry in Australia, and it is proudly organized by ABHF. Before we begin, I would like to briefly introduce our organization to you. ABHF was born from a shared vision among a group of Bangladeshi doctors who believed that health professionals of Bangladeshi origin in Australia needed a common platform, a place where we could connect, collaborate, support each other, and contribute meaningfully to both our professional community and the wider society. Over the time, that vision expanded beyond doctors to include dentists, pharmacists, nurses, allied health professionals, academics, and many others. Today, ABHF stands as a unified voice for Bangladeshi Australian health professionals, promoting networking, professional development, peer support, advocacy, and community initiatives. This webinar series is part of our ongoing effort to share knowledge, guide newcomers, and strengthen our professional pathways within the Australian health system. I sincerely thank our speakers for their time and expertise, and all the participants for joining us today. Your presence truly reflects the spirit of collaboration upon which ABHF was founded. We will have a question and answer session at the end of all presentations, so you may start noting your questions from now and share them in the chat box. We will try our best to address as many as possible. Now, as we move forward towards today's session, it is my great pleasure to invite our first panelist, Dr. Nahid Saima, to share the aims and objectives of this webinar today and her journey as a Bangladeshi dentist in Australia. Dr. Saima is the Vice President of ABHF, one of the senior most Bangladeshi dentists practicing in Australia, a public health specialist, and a mentor to many aspiring dentists. Over to you, Dr. Saima.
Assalamu alaikum, everyone. Thank you for the warm introduction, Samia. I'm truly honored to be here today and to share my journey with you all. My name is Dr. Nahid Saima. I graduated from Dhaka Dental College, D23 batch, and I moved to Sydney in January 2001. That was almost 25 years back. When I first arrived in Australia, the situation was very different than today. There was not even a single Bangladeshi dentist practicing here. Yes, there were a few from our country living in Australia those days, but most of them were either trying to get licensed, had changed their career, or were studying again. At that time, there was a very common belief in our community that clearing the ADC exam was almost impossible. People used to say, the standard is so high, it's too high, and we are not even close. But I was someone who always believed in trying, like many of you. Back in Bangladesh, I was very active during my student life in Dhaka Dental College. I had the privilege of serving as the vice president of Shandhani. I was deeply involved in both academic and extracurriculum activities. I completed my internship, worked in the afternoon, evenings. Then I moved to Africa, got my license there, practiced dentistry there. So when I came to Australia, it was hard, but I told myself, let me at least give it a try. While preparing for ADC exam, I also enrolled for postgraduate studies in public health in University of Sydney, maybe because I wanted to keep it a second option for my professional career. At the same time, I started working at Westmead Dental Hospital as a dental assistant. Now, let me tell you, And let me be very, very honest. ADC was not easy at all. There was no internet those days, no social media, no online guidance like you have today. So I had to spend countless hours in the library. I connected with dentists from other community, other cultural backgrounds. We formed study groups together. We learned together. We supported each other and we kept going. Alhamdulillah, 23 years back, I became the first Bangladeshi dentist to clear the ADC exam in Australia. That moment, that was not just a personal success. That was a message that it is possible. I began my professional journey in Blue Mountain area, then later worked in one of the most prestigious dental practice in Parramatta, Sydney, Australia. Eventually, I purchased my own practice while continuing part-time with Dental Corporation. But my vision was always bigger than just building a career, like many of you. My true intention was to support dentists from Bangladeshi background, those who came here same like me, those who came here feeling lost, without guidance, without direction, and many of us who needed to support the family with kids. Alhamdulillah, over the year, I have owned 3 practices. We had the privilege of training 68 Bangladeshi dentists. Today, many of them are successfully practicing across Australia. Some have completed ADC exam, others have gone on specialize in different areas of dentistry. This, for me, is the greatest achievement. I treasure this even more than my own building more success. And I hope to continue mentoring and supporting my fellow Bangladeshi dentists in this journey. And today, that's the reason I'm here. Today, that's the reason I'm with Australia Bangladesh Health Forum. There is guidance now, there is support, and there is a community. The community is Australia Bangladesh Health Forum. This is exactly what we are trying to do here to support our Bangladeshi health professionals, to guide them, to help them achieve success in Australia. So I just want to leave you with one message. Do not be afraid to start. Do not believe in limitations other places, whoever places on you. Yes, ADC is hard, but it is not impossible. Thank you very much.
Thank you, Dr. Nahid Sama, for your inspiring and insightful speech. It will certainly motivate and guide our participants today. Now, I would like to invite our first presenter, Dr. Chandra Moli. Dr. Moli is currently enrolled in a master's program in University of Tasmania, and she has recently moved to Australia just 2 months ago. And that was after successfully completing ADC Part 1 from Bangladesh. Over to you, Dr. Moli.
Hello, Assalamu alaikum everyone. Hope you all are doing well. As Dr. Samia said, that I am Chandramuli Dey. I'm currently pursuing my master's in health service management in the University of Tasmania. And first of all, I would like to express my gratitude to my respected seniors, especially Dr. Nahid Saimapu, for giving me this wonderful opportunity. It is truly a privilege to be here among such talented and aspiring professionals. I will straight get to the point and hope that this webinar will help each of you to move one step closer to achieving your dreams. If you have any question, please feel free to reach out to us. Now, the Australian dental license exam, it consists of 2 parts, which is part 1 and part 2. Part 1 is theoretical and part 2 is practical examination. This exam is conducted twice a year, and today, as previously said, I will be talking about ADC part 1, the written part. Now, before initial applying to the written exam, we need to confirm our initial assessment, which involves verifying our academic documents and professional documents through the ADC website. Detailed requirements can be found on the official website adc.org.au. Now, coming to the exam structure, The ADC Part 1 consists of 4 papers, and each paper we usually the exam usually conducted over 2 days and 2 papers each day. Each paper is 2 hours long with 2 hours break between sessions. Now, each paper includes 14 scenario-based questions, and each scenario contains 5 questions related to the scenario. Now, exam centers. Coming to the exam centers, previously there was no exam centers in Bangladesh. However, currently there were 3. However, people had to go to India, Thailand, Nepal to participate in the exam. But now there are 3 centers in Bangladesh, one in Dhanmondi, one in Banani, and one in Polton. Now, important tips for you guys is that seat fill-ups really quickly, so make sure to book your exam centers as soon as the registration opens. Now, coming to the question patterns, I would say one unique aspect of ADC exam is the cluster-based question. There are 4 clusters. One is health promotion, information gathering, diagnosis and management, treatment planning, and evaluation. This concept may feel unfamiliar initially, but a key point to remember that multiple answers may be correct, but we must choose the appropriate one based on the cluster the question belongs to. Our pass and fail depends on the cluster, not on memorization. Now, coming on to my exam strategy or the study strategy, I began my preparation during my internship days. I studied 1 to 2 hours daily. Gradually, I increased my study time as my exam commenced. Now, there are core subjects and some core materials which are required for the ADC exam. The core materials are the therapeutic guideline, which is called the Bible of the ADC, and there is infection control, and there's some journals, the Australian Dental Journal and the British Dental Journals, and some additional reference book listed on the ADC website. We can find them over there. Now, what are the subjects? There are endodontics, prosthodontics, oral medicine, oral surgery, just what we prepared ourselves with in our whole year of dental school. Now, what type of practice did I do? After completing my core subjects or the core materials, I focused on past questions. I practiced the scenario-based questions daily, and I used to note my mistakes and revise the key concepts. There are multiple coaching centers available online. I even took mock exams from them, and make sure to verify our answers through reliable references. Now, what are the challenges that I faced? Now, the thing is that new question pattern, we were not used to the cluster types, then the vast syllabus and the resource confusion, also the mental fatigue, balancing work life, balancing study life. It was really hard for us. But, and there's some common mistakes that I would say, which we should avoid, that ignoring cluster-based questions. Mostly what we used to do is we memorize. We do not concentrate on the cluster or the questions. Now, we have to make sure that we are answering the questions based on the clusters. And one more thing is that I must say that please give mock exams multiple times. Otherwise, without that, we won't be able to prepare ourselves. So my final advice to everyone who will be appearing for this exam is that with consistent dedication, structured preparation, and strong belief, trust me, this exam is doable. ADC Part 1 is achievable. Consistency is the key. If I could do it, then each one of you can definitely do it. Thank you so much for your time, and thank you so much for your attention. Passing on to Dr. Samia Panapu.
Thank you, Dr. Moli. You clearly demonstrated how it is possible to complete ADC Part 1 while still in Bangladesh, which is truly very encouraging. It is also great to know that there are now exam centers available in Bangladesh. Just a quick note for our audiences. If anyone has any questions regarding this presentation or ADC Part 1, please feel free to write them in the chat box. We will address them during the Q&A session. Now I would like to invite our second presenter, Dr. Rijwana Rahman. Dr. Rahman is a general dentist currently practicing in a dental surgery in Newcastle. She will be discussing the ADC clinical examination as well as the dentistry career pathway in Australia. Over to you, Dr. Rahman. Just wanted to double check, Dr. Rahman, are you struggling? Should we get our IT support team to help you out?
নিপা শোনা আছে, তুমি আনমিউট করো। নিপা প্লিজ আনমিউট।
Sorry, guys. Yeah. Thank you. Thank you so much, Momo, for sharing such a valuable information regarding part one with us. Good evening, everyone. Thank you for joining us today. My name is Rizwana Rahman. I would like to share some information regarding Australian Dental Council practical examination. I do remember working as a dental assistant full time with Dr. Nahid Saimapu, having the dream that I will be practicing as a dentist in Australia. If you can dream, you will do that. We will gonna go through around all the steps of Australian Dental Council practical examination today. Please feel free to ask any question on our question and answer session. The practical examination is the last stage of the dental practitioner assessment process. It is not just an examination, but a platform for us to show that we are competent to practice safely and confidently as a general dentist in Australia. The whole examination is held over 2 days. Day 1 is the technical skill day, and day 2 is clinical skill day. So technical skill day, which is technical skill examination. During the technical skill day, we will be given 6 tasks to complete on a pre-prepared typodent model in a mannequin head. Exactly, this is the exam room. Usually the tasks are divided into 2 clusters. One cluster is preparation cluster and the second cluster is restoration cluster. Under preparation cluster, there will be 3 tasks. Metal ceramic crown preparation. Now I'm sharing few photos of my work during the preparation time. We used to take lot of photos and share with each other, like among the study partner, to assess our own work. The second task is under the preparation cluster is cavity preparation or preparation of carious tooth, and then the third task is endodontic excess cavity preparation. Under restoration cluster, the 3 tasks are posterior resin composite restoration class 2. We used to have 1 task which is amalgam restoration, but new changes has happened, which is amalgam restoration will be replaced by anterior resin composite restoration, which is class 4. And then the final one is provisional crown restoration, which is temporary crown restoration. Now, ADC set certain criteria for each and every task. We just need to follow all their criteria to pass this exam. Very important. These criteria are very important. So as for example, like for restoration cluster, we really need to focus on proper contact, proper contour, proper marginal height, cusp height and position. And also on the technical day, it's very important to follow the infection control guideline because it is very crucial. Now the setup, home setup basically, it can take proper 6-month preparation to get ready for part 2 clinical examination after passing part 1. I do recommend to have home setup, your own home setup. That's the base, so that you can manage your own time and practice as much as you can do. It is a journey, dear, and we have to make ourselves ready to overcome this journey. Now, the second day, which is the clinical skill day, it is just a half day exam. The whole clinical skill day is divided into 10 rooms. Room 1 to 6 are set up for standard consultation room. You will be given a full scenario like this, with a photo or x-rays or some charting all together, and you will be given 3 minutes to read the scenario, and then 10 minutes time you have to do the role play. So role play room will be like the second picture you can see. So there will be two examiner. One examiner will gonna play as a patient. She will pretend as a patient, and one examiner will gonna mark you. Room 7 to 10 are set up for dental treatment room, where you will ask to finish certain task within 10 minutes. For example, x-ray taking, or maybe rubber dam, placing fissure sealant, so on. So this is a model of communication OSCE. They will provide, as I say, that they will provide something to have the communication tools. It is paramount that you read the question carefully and understand what they want you to do. Now, understanding result. From this slide, it is very clear that to pass the whole exam, every task, every room is equally important. It is a cluster-based examination. So we have to focus the basic criteria for all the tasks, including infection control and effective communication. I got lot of question. Is ADC difficult to crack? Is the passing rate is slow? Now, answer is every exam is difficult, is stressful, but with proper understanding and guideline, we can crack the exam. I used to tell myself, which I always tell to everyone, that prepare yourself in a way that you believe in yourself, that if one candidate pass in on your day, your exam day, it has to be you. Now, some unavoidable challenges are financial challenges. ADC practical exam is very stressful with highly significant financial challenges. Now, especially for overseas dentists. Now, whole exam with preparation courses can cost ranging from $30,000 to over $50,000. Often candidates fail because, as I said before, they don't understand what ADC want you from us, and also we have to be very familiar about the Australian standard and their criteria. Some other challenges which I want to focus, which is the exam stress. Most importantly, managing your own stress. Having a good study partner can make this journey easy and less stressful. We used to work full time as a dental assistant, managing family, and at the same time preparing for ADC. So everyone has to go through the same struggle. But believe me, guys, after ADC, the life is full of rewarding with joy, respect, financial independence, and settled. Now, failing. I do fail myself for quite a lot of time. It is very common not to pass the exam in first attempt, which is totally fine. Failure encourages us to think outside the box, forcing us to try new and more effective way. More attempt can make you more professional and more confident. After finishing your ADC exam, we have to apply for the registration to Dental Board of Australia. It can take 4 to 6 weeks with proper document. We need to provide them the English language test result with score of each band not less than 7. Now, most important, most popular question from everyone, which is the jobs and visa option for dentists in Australia. Dentist job opportunity in Australia are very wide with high demand, especially in regional areas. You can work as a general dentist in private clinics, corporate organization, public sector with high range of income. Now, some visa option I want to discuss, but it's always better to have a good lawyer which has the understanding about the immigration rules and regulation. Some visa option are available, like most popular visa option nowadays for dentists is subclass 482, which is temporary skill shortage visa. With this visa, your employer or any corporate can sponsor you and allowing you to live and work in Australia up to 4 years, which can follow the permanent residency as well. One visa option is subclass 491, which is skill regional visa, which allows dentists to live and work up to 5 years with a pathway to permanent residency after 3 years. And also you can directly apply a PR as a dentist after finishing ADC exam. Now, as I mentioned, that is always better to have double check with a good immigration lawyer. And also we have discussed some visa option in our first webinar, so you can have a look for reference as well. I know the whole process can be overwhelming and can be confusing as well. Please don't hesitate to ask any question. We are here to help. Thank you so much for your time, guys, and your attention. I do appreciate the effort of the whole ABHF team for organizing such a thoughtful webinar. Thank you so much.
Thank you, Dr. Rijwana Rahman, for your excellent presentation. I hope it has been very helpful for our all participants. Just to remind you all, you are welcome to ask questions in the chat box. We will address them during the Q&A session. Also, please note that this webinar will be recorded and available on our page, so you can revisit it later on if you have missed anything. Now, I would like to invite our second panelist, Dr. Rahena Akhtar. Dr. Akhtar is an EC member of ABHF, Associate Professor and Head of Cardiology at Sydney Dental School, University of Sydney, and a principal dentist in her private practice. She will share valuable insight on how one can successfully build both clinical and academic career pathway in dentistry in Australia. Over to you, Dr. Akhtar.
Assalamu alaikum, everyone. I hope you're all hearing okay. Thank you, Dr. Sabrina, for such a lovely introduction. I would also like to thank my colleagues who have already presented the clinical pathways so beautifully. So today I will briefly share my journey and give you an idea of what an academic career in dentistry looks like in Australia, and how you might prepare yourself if you are interested in pursuing this pathway. I am both an academic and a practicing clinician, as you already heard. I have completed my ADC examination nearly 15 years ago. Currently, I am an associate professor and head of the cardiology in restorative dentistry, as also academic lead in Doctor of Dental Medicine program at the University of Sydney. I graduated from Dhaka Dental College D31 batch and completed my PhD from Japan, Hokkaido University, under the prestigious Japanese government Monobushi Scholarship. And then I started my academic career in Japan as an assistant professor in Okayama University. And as a foreigner, I must say it was an amazing experience while I was an academic in Japan, because I was the first academic appointed in Japan and as an academic, because I have to give all the lecture in Japanese, as you can imagine. I have now been at the University of Sydney for more than 15 years. And my role at the university involves teaching, research, and contributing to global leadership and professional development initiatives. I started my journey at the University of Sydney in 2009 as a postdoctoral fellow in orofacial pain. And then I have been an orofacial pain specialist since then. Over time, I gradually transitioned into academia, progressing from lecturer to senior lecturer and now associate professor and the academic lead as well. As a researcher, it is very, very fulfilling. I love to do research. I'm sure many of you also see it as a dream. As a researcher, I published around 150 peer-reviewed international papers, and I have secured over $3.8 million in research funding from Australia and internationally. I have also presented more than 100 papers in national and international conferences and organized several international conferences and symposiums as a convener. So I just want to encourage everyone what you can dream of and you can achieve as well. I have supervised many HDR, which is higher degree research students, including honors, masters, and PhD candidates. In addition, I have received several international awards in dentistry, and currently also I am an editor and reviewer of several Q1 international journals. Now, having said that, I would really like to share a little, briefly discuss about what an academic career pathway in dentistry looks like in Australia. Dental schools in Australia offer both undergraduate and postgraduate programs. The University of Sydney, especially where I am, runs a postgraduate dental program, meaning that all students entering the Doctor of Dental Medicine program already hold a previously a university degree before starting dentistry. And after graduation, there are several possible career pathways. Graduates may pursue as a specialist training pathway through Doctor of Clinical Dentistry program, or they can also continue into the higher degree research pathway, that is master's or PhD program, or they can work as a general dentist in public hospitals, or they can work in a private practice. Now, for this webinar, our Bangladeshi dentists and those who are interested in academia, there are several roles within dental schools. One pathway is becoming a clinical educator. Overseas trained dentists can work as a clinical educators in an Australian university. Particularly, they can take role into the simulation clinics and preclinical teaching. And for that, you don't have to have an ADC, exam completion of the ADC exam. In fact, several Bangladeshi trained dentists are currently working with us as a clinical educator in our Sydney Dental School. Another pathway is becoming a lecturer or academic staff member. This typically requires a master's or PhD. Academics play a crucial role in advancing our dental science, education, and public health, and they can make a meaningful impact in our community. There is also a research pathway, so you can also become a researcher only, and we have several positions available at the university. Researchers usually pursue higher degrees, such as PhD, followed by postdoctoral research, and they also have to show a competitive successful grant funding. Networking and collaboration are extremely important for anyone interested in this pathway. And I strongly encourage Bangladeshi dentists to build professional networks by attending conferences, seminars, professional meetings, especially if you would like to come in Australia, then try to attend the conferences organized by Australian Dental Association that happens every year. Some ADX events, which is happening now. I was actually presenting this morning in the ADX event. International Association of Dental Research. You can also join FDI and other webinars. Mentorship is another pathway. It is also very valuable. Connecting with experienced academics can provide guidance, support, and directions. You can navigate your professional journey in that way as well. So my final message is that success in the academia is achievable despite obstacles. Moving to a new country, adapting to a different academic system, and building a career can be challenging, and that's understandable, but it can also become a very rewarding and fulfilling journey. And I would like to encourage and inspire the next generation of Bangladeshi dental professionals to consider academic and research careers in Australia. With dedication, mentorship, collaboration, and perseverance, you can create meaningful contributions to dental science, education, and global oral health. Thank you for joining. I'm happy to answer any questions.
Thank you, Dr. Rahena Akhtar, for your informative and insightful speech. Now we will begin our question and answer session. Our expert panelists will be answering your questions from the chat box. You can also email us for further questions. Our email address is on the poster of this webinar as well. We have already received several questions from participants, and we will start answering those questions. So the first question, anonymous attendee. Assalamu alaikum. Is it better to pursue a master's degree first or go directly through the ADC pathway? I guess Dr. Nahid Saima, will you please answer this question?
Yeah, thank you. I can answer that. I think it depends on your personal interest and what you actually want to achieve. If you want to have the ADC license and that's your ultimate goal, you can always starting that from Bangladesh. Saying that first part may be possible from Bangladesh, but eventually you will need to be here. You'll get some short visa only for clinical to come here. But if you want to learn the culture, if you want to be prepared yourself properly with the patients and the environment here, it's always a good idea to come here. And coming here with a long-term visa is only possible if you come as a spouse or as a student in post-graduation. So I think you have to choose what you want to do. ADC exam can be very, very uncertain, like you won't know how long it's going to take. So I will suggest that try both so that you are not frustrated or you are not tired of just focusing on one thing. So yeah, it's up to you. Thank you.
Thank you, Dr. Saima. Our next question is, what's the procedure of appearing ADC Part 1 from Bangladesh? Perhaps Dr. Chandramouli is the best person to answer this question.
Yes, well, somebody like me, well, what I did is, as I said before, I studied during my internship, and then I took part in the exam part 1 in Bangladesh, and then I came to Australia for my master's. So you can do the same for yourself if you are confident about yourself. But I will tell you to do your own research and see what is more suitable for you. Thank you.
Thank you, Dr. Morley, for your prompt answer. I'll go on to our next question. Is there any question bank or previous question collection for ADC Part 1? I guess again we're going to go back to Dr. Chandramouli to answer this question.
Well, sorry, I missed the question. Could you please repeat, Apu?
Yeah, sure. So the question is there any question bank or previous question collection for ADC Part 1?
Yes. Well, yes, there are some past questions. Our ADC recently released a question, demo questions in their website. Please do check it out. They have a whole set of questions. And as I said, that there's some coaching platforms available online. If you do get admitted to them, and they will give you the question papers, and they will also offer you some free mocks. Please keep an eye on their website, on their Facebook pages, and the groups for ADC. You will get those available over there. Yeah. Thank you.
Thank you. I'm going to have to go back to you again with our next question, which is, from which platform I can give mock exam?
There is Dr. Vido. He is quite popular over here. Then there is Winspert by Jigyasa. She is also very popular. And there is Dr. Raza Abbas. They each have their own Facebook pages and their own Facebook groups. So just keep an eye out before each exam, during March and September, they usually give out free mocks. Just keep an eye out and be attentive. You will be able to register for the mocks and take part in them. Yeah.
Thank you. I'm going to give
Can
you
I
a
add
break.
here as well? It's always a good idea to create a team, like how Nipa and everybody's here. Create your own circle and practice yourself as well. Don't just depend on those professional coaching center. There are a lot of other Bangladeshi dentists who are preparing, and you can do it at home.
Thank you for adding up, Dr. Sama. I'm going to go back to you with the next question. Does passing ADC Part 1 allow me to get a visa to enter Australia, or do I need to enter on a master's or PhD student visa?
Completing part 1 will allow you to get a visa, but that's only for a short time. That's only for the clinical exam. You won't be able to live here for long term. So depends on how long you want to stay. If you want some long term permission, then I guess coming with a higher study will be another option.
Thank you. I'll move on to our next question. Is it possible to make up the cost of Part 2 coaching and exam with the income as a dental assistant in Australia? I'll invite Dr. Vijawana Rahman to answer this question.
Thank you. It's a very important question. Whoever asked this, I did it by myself. I told that I used to work with Nahida as a dental assistant full time. Remember, I used to work 7 days.
Yes.
Yeah, it
I
is
can add
possible.
one though, Nipa. It's not easy. You are
Not
very,
easy.
very hardworking. Everyone is different, and when someone comes from Bangladesh, not everybody's capacity are same. We have so many Bangladeshi dentists who are actually get the support from their husbands, like or wife. So that having a partner, supporting partner is very, very helpful here.
Yes, I do agree with you, Apu.
Yeah.
Yes.
Thank you. I'll go on to our next question. What is the procedure of appearing ADC Part 1 from Bangladesh? I guess Dr. Moli is the best person to answer this question.
I think she already did, isn't it? She
Yeah.
already explained that. Yeah, that's answered.
All right, sorry. So I'll go on to the next question. How can we collect the study materials, hard copy and soft copies both? Who wants to answer this?
I think Nipa will be the best person here.
I think Dr. Molly has already explained that if you join some courses, they will give all these things like online thing, soft copy as well, and hard copy. Few books you can buy from Bangladesh, which I did when I came to Australia. I brought some books and all this stuff, but mostly I think ADC preparation. Momo, you will probably correct me. Nowadays, mostly it's like soft copy, so you don't need to do any hard copy. All things will be online, and then soft copy material, and then the coachings are providing all this stuff.
Yeah, not everyone have to go through the coaching though, isn't it? Like even the ADC website have a book list.
Yes,
They
okay.
have a big long book list, but then you talk to your friends, you talk to the other people who are doing the exam,
Yes.
preparing, and which ones are more important. So short, like prioritize it, isn't it? Like friends are always that
Yes.
groups are really helpful.
Yes, yeah, I do agree.
I'll go on to our next question. But before that, for all our participants, we do have an option that you can actually email us because you will be having hundreds of questions after this webinar, I believe. So you can actually email us with questions and our team will be getting back to you as soon as we can. So moving on to our next question, which visa category is available for students past Part 1 from Bangladesh and willing to move to Australia for Part 2 preparation and exam other than spouse visa or master's visa? Who wants to answer this question?
I think tourist visa or some training visa available. So best if you can find a agent in Bangladesh. They have lot of option, like they can discuss with you. They are professionals. I think it's the best idea to discuss with a professional in Bangladesh so that they can provide you a lot of options.
Thank
Yeah,
you.
because the criteria are changing regular. Australian government immigration has it's continuously modifying. So best to check with them.
I'll go on to our next question. Is it true that in Australia, to get a job, work experience in local clinics there or personal connection are more helpful than students who have passed ADC Part 1 and Part 2? Who would take this question?
Nipa, you want to answer or you want me to answer? I can answer. Like connection always helps, isn't it?
Yeah, yes,
Anywhere
always,
you go,
always.
you're networking. If you want to survive, if you want to do well in overseas, any country, networking is the first option you have to have. But if you already are a ADC graduate, like if you cleared ADC and you got the license, you can apply anywhere and you will have that confidence to face anyone, to get a job. You won't need anybody. But to have a circle, to have connections, it's easier. It's much easier.
Thank you. I think that actually that sort of answer is really helpful, Dr. Sama. And also, I want to add that sometimes it's really based on your individual circumstances.
Yeah.
So again, going back, talk to a professional in that regards, like maybe a good immigration lawyer would be a very, helpful option. I'll move on to our next question. Recently, I had done my IELTS. I want to know, should I move first or should I move after at least one attempt to sit for Part 1 here from Bangladesh?
This is a hard question. This is a tough question because living here in Sydney or Australia is quite expensive. Lifestyle will cost a lot of money. So if you have the opportunity that you can give exam there while you are actually preparing to come here, I feel just go for it. Because once you come here, it's going to take some time to start your work, to start earning, to rent a house, to pay for your bills, and then at the same time pay for the exam. So if you have the easier option in Bangladesh for first part, why not? I feel that way. Thank you.
Yeah, I think it's a blessing now that we can give the exam Part 1 at least at in Bangladesh. I think it's more easier. So when you give your Part 1 and you finish that there, you'll get more motivation and you can come. Then it's a good idea. Yeah.
Thank you. Our next question. I passed BDS in 2022, completed my internship in 2024, did not do any post-graduation training, still confused about what to pursue. So I wanted to know if it is possible to go to Australia for MPH, then prepare for the license exam, or would it be either better to focus on just one thing? In that case, then which university would be better for master's degree or later on for PhD? What are the requirements? Any chances for scholarship?
I guess this question is for me.
Yes, I was going to say that.
I
Thank
can
you.
say, yeah. Look, this is a very valid question. I guess many of you probably want to know this answer, and I couldn't describe more in my, short presentation. So the thing is, yes, you can do MPH if you are really interested. Now, one thing I certainly tell you, if you have research interest, then you should pursue to the research pathway. And later, you have always the opportunity to go and do your clinicals, do the ADC exam, which is not going to stop at any point of time. But if you have interest in research, then you can pursue any universities in Australia. Most of the Australian universities, they run exactly the same way. They have their master's program, PhD program, exactly the same requirements. So the main requirements is definitely if you want to do master's, then you have to have some little experience in research, have been doing anything that you can do in your current environment. And then you should communicate with any supervisors in Australian university, any field that you are interested in. and you can find those information in the website with the respective discipline that you would like to do. But if it is MPH, of course, MPH has a specific MPH program as well. So you can, apply, and then there is student portals where you can apply for that. Now, you also asked about the scholarships. I have to be honest, for master's program or MPH program, unfortunately in Australia, there is no scholarship available. I won't say no, but there's hardly anyone get it. But yes, for PhD, there are lots of scholarship available, internal, external, and international as well. So if you would like to do MPH or master's program, you have to be prepared to pay for the tuition fees and also the living cost in Australia, which is very high, as you know. But if you can afford it, that will be definitely rewarding. And you can always have a chance to progress to PhD. And at that time, if you have publications, then you can apply for the scholarship and you can get exempt from your tuition fees. And also you can work at the same time, you can prepare for ADC exam as well. I hope that answers the question.
Thank you, Dr. Akhtar. I'm going to move on to our next question. How can I find the clinical practitioner job? I have almost completed my PhD degree from Japan.
Okay, looks like this is also my question. That's a good question. I myself finished my PhD from Japan, although long ago. It looks like it is a similar journey you are having. So if you would like to come to Australia as a clinical educator, I don't think it's straightforward, but it's possible. Definitely possible. But in our Australian universities, I'll definitely talk about the University of Sydney because this is where I'm a long time. So we take clinical educators from overseas trained dentists, but who has the experience of working as a kind of, they have previous experience of the universities, or they have previous university as a research assistant, not research, like a teaching assistant. Because if you are doing PhD, definitely you should have some experience of the teaching assistantship. So that actually values when you apply. So we have always the open opportunity for the clinical educators, because in our Sydney University, we have around 250 clinical educators because our students number is quite high. So we need a lot of clinical educators to teach them in the clinic. I guess keep an eye on the website and have a look in the job opportunities, the section, and you'll be able to see there is a clinical educator needing, there should be a job advertisement. Most of the time it is there, and you can just apply directly from there with all the qualifications, and then you'll, if you are selected, you will get an interview, and then you can get, the position.
Thank you, Dr. Akhtar, for a very inspiring answer to this specific question. Our next question is, I have seen there are very little fund in MSc or PhD. Can you please tell me the minimum criteria to get a fund? Also, which subject of health field can lead to get a PR and will give me a good job exposure with high pay scale?
Wow. That is also for me, I think. But
Yes.
I think that's a very ambitious question, but that's good. I love that. The thing is, I already answered about the scholarship, I guess. As I mentioned, if you say MPH or the master's, unfortunately, there is a scholarship rate is very, very low or minimal. PhD, yes, but it also depends on the criteria. So the criteria that's you would like to know, that is, you have to have publications, and that should be as a first author, international publications, mostly Q1 journals. In Sydney, at least in the University of Sydney, so far as I know, we do not count any publications below Q2 journals. Q1 and Q2 is the minimal requirement. So that's the publications, and you should have a couple of publications, at least as a first author and second author. And then you have to have some grant applications, successful grant applications. Whether it is a small amount doesn't matter, but you have to show some evidence that you have been successful as a grant receiving a person, and as well as you should have your completion of masters if you would like to pursue PhD. So criteria is mainly these. Then it will be competitive with other, PhD applicants in the university. And then if you have this criteria already, you will be most competitive one. And then obviously you will get the scholarship, at least international. We call it as RTP scholarship in Sydney University. And RTP scholarship is the internal that Sydney University provides. And this actually covers the tuition fee. So you will be free of tuition fee for PhD program. And also, I think you will get some lump sum amount of money as well for your living costs. So, yeah, so this is possible.
Can I add here one thing as well? Because I know a lot of dentists comes here with master's program, but many of the masters or PhD might not lead you to a PR ranking, because Australian immigration system is different. So most of the dentists, what they do, if your ultimate aim is to get the residency here, then just come with the subject you can afford at this moment. Then while you are here, consult a proper agent and change the topic, change the subject. Every year it's different. I know this year health science, social science, health management, there are few subject that is leading, but it changes every year. So if your goal is to do the PhD and work and earn money, what Dr. Rihanna said is perfect. But if your goal is to earn the residency, then change to something else. But at the same time, prepare for ADC exam. Once you become a dentist, once you have the license, you can get the residency at the same time. You can apply for it. Thank you.
Thank you. I'll move on to our next question. After passing ADC Part 1, how much time does one usually get to prepare for ADC Part 2? And when do you get to sit for Part 2? You might want to answer this question, Dr. Moli or
No,
Dr.
Nipa.
Nipa. Dr. Nipa?
Now the new changes has happened that you can give the exam as many time as possible during the year. Initially, it was very hard to get the dates, but now they run this exam every month. So getting a date is not an issue. But I do recommend to prepare yourself first, then go for exam, because if you don't prepare yourself and go for exam, it's like a little bit of frustrating for you because of lot of money issue. So I would say that after finishing part 1, getting a home setup, practicing yourself, technical and OSCE, communication OSCEs, practicing with this can take it depends on like person to person, but it can take 6 months, 3 months to 6 months to prepare yourself for part 2 exam. And there are a lot of coachings, technical and communication OSCEs are available here in Australia, which we had done it before. So they will help you to prepare yourself as well.
There is a limit though, isn't it, Nipa? There is a time limit that after part 1, you have 3 years to complete the
Now
clinical exam.
good news is from this year they change it to 5 years, so it's a very
wow.
good
That's
news.
great.
So
Yeah,
that's
great.
great. Though
That's
Momo
great.
probably will not gonna get it because the good news has happened after she passed her part 1.
Yes,
But
of course.
Yeah.
but whoever will pass from this March, they will get 5 years. Within 5 years, you
Excellent.
have to. Yeah, this is excellent.
Excellent. So otherwise, unless many of the dentists here, they had to, lose everything and start from the scratch again, because the 3 years goes very quickly. So it's
Very
good that
quickly.
now
Yeah,
you have 5 years.
yeah,
Excellent.
that's the very good news.
That's also a sign that they actually need dentists. Like there is a
Dentist.
huge demand here, and it is actually one of the very respectable profession. And we do use very high, sophisticated equipments here, and you will feel good. Like it's such a satisfaction to work as a dental surgeon in Australia. So I actually recommend that in Bangladesh, lot of our juniors or even friends or seniors, like I know many of you are doing well there, but the professional satisfaction, the living standard, Australia is actually one of the best country, I would say, this world. I think many of you will agree with me.
Yes, Apu. And
Yeah.
also, I want to add, there is a myth like that passing rate is low, and then this kind of thing. I think whenever you will be ready, you will gonna pass for this exam. So after passing the exam, you know that it's you are now ready to practice as a dentist in Australia anywhere. If you do as a sole practice in a regional area or anything, you can handle patient all this stuff. So by that time you will be ready. You'll pass this exam. So now I can see a lot of candidate they are passing. So I don't think so that passing rate goes low or something. It's just all about your preparation, your hard work. So yeah, I think it's a myth that
Yes, it
yeah.
is. I think like for last 25 years that I'm practicing here, one thing I realized that ADC, they want to make sure that you are a safe dentist. It doesn't matter how complicated, how complex treatment you are doing, how big like case you are solving. It matters how safe you are on patient, how respectful you are to the patient, how you treat them well, how you can refer them when you need to, like just how you are open to all the other option, how patient's right is the priority. That if you know and if you accept that fact, and if you can to train yourself that way, then rest of it is we all know dentistry. It's just the culture here we have to understand, that's all.
Thank you. I'm just going to go on to the next question, just being mindful of our time. Is there any age limit to sit for ADC exam?
Mhm. I don't think so. There is any age limit to sit for this EDIS exam. Yeah, we do. We used to when we used to prepare. So there are a lot of senior from different countries. They said we have 15 years, 20 years experience. Some have no experience. So I don't think so. There is any age limit for EDIS. Nahid Samapur and Dr. Rehan Akhtar Apu can correct me, but I think that probably
No,
there
you're
is.
right. You're
You're
right.
right.
There is no age limit.
No age
All
limit.
right. That's actually good to know, and that's quite exciting for our participants, I believe. Next question. Since each step of the exam process is quite expensive, what advice would you give to a middle class student?
Work hard.
Hard.
Study hard. Your brain cell can have the potential of keeping a three library full of books in our brain, isn't it? I think that's what we know, but we don't practice that much. So while we prepare for the ADC, we try to make ourselves even better. We can. I remember. I think you all will agree. Like we used to study and practice more than 20 hours a day, isn't it, before clinical exam, practicing and studying and conversation and mock exam. We did that continuously and worked at the same time. So hard work and intention, hard work and the dream that I want to do it.
Yes,
If you
and
have
I
a
guess
dream,
the
you will
confidence on
achieve it.
top as well.
Yeah, if we
All
can
right.
do it, we came from very middle class family. Like I had no support at all, and instead of that, actually, I had to support. I came with two little kids. My boys are just 2 years and 5+ that time, so we had to pay for the bills. We had to buy food. We had to cook. We had to send them to school,
Papa, you
and
had like a long way
so
that you have
yeah,
actually
yeah, we all
passed.
did that. We all did that, and that's fine, perfectly fine.
So I'm going to go on to our next question. We have actually got a few more questions to go through. Is there any opportunity? I guess it might have been covered already. Is there any opportunity to get full funded scholarship for PhD? How can someone get that? Perhaps Dr. Akhtar can answer.
Yeah, I think I have already discussed this answer already.
So
As I mentioned, like PhD, yes, it's possible to get a scholarship, but there are criteria which I just mentioned earlier. If you fulfill those criteria and if you are competitive enough with other PhD, the candidates, then yes, you will get the scholarship. And scholarship, there are so many different scholarships. If you are applying as an overseas trained dentist or overseas applicant, then you are only competing with the international candidates, not the local candidates. And you will be able to get the scholarship if you can fulfill those criteria.
Thank
Criteria
you.
means a publication grant, those.
I guess what I would suggest, if there's a repetition of question, audiences can always go back to our webinar page where there will be the live stream, recorded stream available for you. Moving on to our next question, do you have any group or platform where we can stay connected and get your guidance continuously?
Deepa, do you want to answer or who wants to answer?
Look, definitely we are here to help. So you can send email to ABHF platform. They have their email address. Or if you want to contact personally, surely you can do that. Messenger, Facebook, all this stuff now they are available. So it's very easy to get someone nowadays. I do a lot of messages. I try my best to answer each and every one's question, call them back and then talk to them and then explain my journey. So feel free to do so.
Thank you for being so kind. Next question. Dr. Rahena ma'am mentioned about different webinar conducted by Australian Dental Council. I would like to know how to connect or join these programs.
That's actually a very interesting question. Australian Dental Association is actually, you have to be a practicing opera registered or ADC completed dentist here. So you can register as a dentist in Australian Dental Association, which is and then of course you'll get all the opportunities in their resources such as webinars, the publications, grants, and a lot of mentorship. So a lot of things, but I can find it out if as a non-dentist and as overseas, if there is any opportunities. I'm actually, that part I'm not 100% sure, but I can find out and I can give that information to ABHF too.
I can add it here. I called them few days back to ask this question. So when I came here, usually the initial assessment, when you have that initial assessment done, then if you call to ADA, like Australian Dental Association, they will just provide you the membership. But they said like they want an address from Australia. They said that you have to be in Australia.
Okay.
To have to be the member there. But initial assessment is enough, Apu, you can be a member to ADA.
Oh, great. Okay, so that answers the question. So then
I
it's
think
fine
you
then.
get the registration as a student, isn't it? Like,
as
yeah,
student,
you get the
right,
student registration.
But they
so you
need
don't have to pay anything.
Yeah,
It's free.
But you need to have an address in Australia.
Yeah.
Okay, right. Okay, then in that case, you can still get the webinars and all resources that is available in Australia.
All these resources,
Australian Dental Association. Yeah. I think that answers.
Thank you for for answering all the questions. Now I'm just being very mindful of the time. It's getting quite late here. It's past midnight. So, and we have this limited time. So I'm going to have to, ignore all of these other questions that I have, but we will definitely be responding to these questions. If you can email to us, our team will, dedicated team, I should say, will reply to you with prompt responses. As mentioned earlier, this webinar actually will be available on our page, and you can go back and watch it again at your own time. as the time is so limited, I would like to conclude our webinar today by thanking all our participants, panelists, speakers, and our IT support team. We hope.
Before we finish, can you just tell them that we have the next webinar? I think I put the thing on there. Yeah, thank you.
So we hope that this webinar is useful for all of you. Our next webinar, which is the third webinar in this webinar series, will be conducted, as you can see on the screen, on the 17th of April 2026. Topic of our next webinar is AMC exam and job opportunities in Australia. Thank you, everyone. Do feel free to email us with all your questions, and our team will be able to answer those questions. Thank you and good night.
Thank you, Dr. Savini. Thank you.
Thank you
Thank
for
you, everyone.
having us.
Thank you, everyone.
Okay, bye-bye.
Bye-bye.